relative to maybe how much toxic exposure you have had and how much your body has decided to store in your body fat and what body fat your body decided to mobilize. So you can see there's so many variables. At any point, again, does this mean that you need to be on excessive detoxification support? Just as much as I could say not necessarily, I could say potentially, right? So I would say that if you consider your health on the lower end, if you are maybe more stressed in your life, because that's always another variable, the more stressed you are, the more your health is compromised during that time of stress. So detoxification, toxic release during weight loss. So this is something that I don't think I've actually talked about. So when you drop body fat, you are releasing toxins. And this is why I've always stressed optimal health alongside weight loss. They have to be paralleled. You have to combine them and be thinking the same thing, because optimal health means your body can handle the release of toxins from stored body fat. But that's what happens. So you are putting a burden on your body, specifically detoxification needs, when you are dropping body weight. So it's something that becomes an issue if you have issues in your body's ability to detoxify. And so relative to maybe how much toxic exposure you have had and how much your body has decided to store in your body fat and what body fat your body decided to mobilize, so you can see there's so many variables. At any point during a weight loss journey, you could release a higher amount of toxins than you could at any other point. Now, again, does this mean that you need to be on excessive detoxification support? Just as much as I could say not necessarily, I could say potentially, right? So as you guys know, I've always tried to not overburden you with, you must do this and this, when I don't know if every individual in particular needs that. So I would say that if you consider your health on the lower end, if you are maybe more stressed in your life, because that's always another variable, the more stressed you are, the more your health is compromised during that time of stress, right? So the more stressed you are, the more subpar you think your overall health is. I would definitely consider adding some detoxification support. So a few of you were asking for some liver detoxification support. That product, the liver and GI support, would be the same product that I would recommend if you want to support your body during the fat loss process. Again, you may or may not need it. There's no way to know. One way to know if you're not supporting your body and you are a particular person who needs it, signs and symptoms would be you start feeling worse. Because this is what happens when people go on liver detox programs. You're detoxing your liver is releasing a lot of toxins, but if your GI system can't excrete it, you don't feel good, you feel worse. And so detoxification is always something that should be done in a body who has reasonable GI support, reasonable GI health on itself. So we had a question about protein. Working on getting protein in. Everybody should be working on protein. Everybody should be getting the resistance training and protein. Resistance training and protein. You guys will always hear me harping on this. Should we limit the amount of protein in one sitting? That's a great question. So there's some idea and some people that state that your body can only process so much protein at one sitting. And then there's complete opposite information that says, no, your body can handle as much protein as you give it. And so this isn't there's no clear consensus on this. There's literature on both sides. I believe your body can handle large amounts of protein from what I've seen. I think as observed by heavy amounts of fasting, you guys know you're sitting here and you're doing it, right? Fasting for 48 hours. And if you do this program, you don't lose muscle, you even gain muscle in many cases. So there's no way your body would be unable of storing and utilizing proteins as observed by what we're doing with this program. So that's why I feel very confident that your body will utilize as much protein as it needs if it has it available from your diet. With that being said, does that mean you shouldn't strive to have protein every meal? No, I do think that having protein every meal has its own benefits. Number one, trying to get protein every meal is always just going to keep the satiety level higher. Number two, striving to get protein every meal makes it less likely that you don't slip up and not get enough protein, right? And there really is nothing to be concerned about with getting a little extra protein. Yes, we could say, and I've talked about this before, like kidney issues with super high protein, super high. Yeah, that's definitely potentially an issue, but it'd be hard to really get that higher protein. So I'm still a fan of trying to spread out your protein consumption, but don't feel, in fact, you should go really high in protein if, say, you're like, oh man, I haven't had protein. If you're not in, like, number one, after the 48-hour fast, you should be thinking protein because you just went 48 hours. So that's definitely a time, that first day or two, you should be shooting as for adequate calories, but also really high protein. Once we get past that first day or two, your body's kind of back to stability. You should be just thinking your general higher protein consumption, but not necessarily as high as maybe what you're shooting for the day or two after the fast. And then in your normal operating basis, if you just notice, oh man, my last couple meals haven't had protein, then definitely it's a good idea to go ahead and look at that next meal and say, how can I get extra protein? And so, for example, a protein shake with your protein meal could be a great way to catch up, because obviously it'd be difficult to consume twice as much meat. you probably would get real full really fast and wouldn't be able to eat the rest of your meals. So that's a great opportunity. And another reason why protein supplementation and protein shakes are very much a good aid for us to have along this journey.
This week, I ran into a difficulty. I had to eat, so I couldn't fast this week. So I'm going to start on Sunday.
Okay.
But that's why I was asking about the DIM. I'm wondering if it's something I can do to
When you said
take.
you said you were getting sick, like just like an
No, I
infection
was
type
just
sick?
no, I was just sick. I couldn't. I was in the bed for a few days and I just was wiped out the whole week. It just felt nausea, just not being able to eat, just feeling like I was gonna vomit at any minute. It was just weird. It was pretty interesting. Usually the last several months, I used to have bad periods when I was younger, but the last several months they've been stable, no issues. But for some reason, this month it was really bad. And so I started fasting just to keep the rhythm because I asked you about the ADF last week and I stopped the ADF and I was just going to get back on the 48.
Yeah.
And then I just couldn't do it. I was like, so I was, yeah, it was so I had to eat something. I felt a little better, but it took about 4 or 5 days for me to feel like myself again. Even the Aleve, I can usually pop a few Aleve and the PMS and all that stuff will go away, but the Aleve wasn't even helping this time.
And were you describing the symptoms as nausea, diarrhea, and vomiting, or?
It was just more like nausea. It felt like I may vomit, but I never did vomit.
Okay.
The hunger pains were like more exacerbated, I think, just because I was feeling so sick. Yeah. And then I didn't even want to eat. Initially, I was like, I'm not hungry.
Yeah.
But then my body was like, you have to eat something because I was literally like slumped over the bed like I was on my last breath or something. I was like, what is going on? And
Totally.
so I just stayed in the bed and I just was like, you need to eat. You're just going to have to eat. You're not going to be able to make it this time. And this is the first week I didn't fast.
What
So
are you still on the 2.5 dose?
I'm on a 2.5 dose. I didn't take it this week because my stomach was bothering me so much and I was so bloated that I just was like, I can't take anything. So I didn't take it this week.
Was there any other changes in your lifestyle? Because I was curious if this was after you increased your dose. Because what she explained is totally something that I could see happening when you increase your dose. So just that's what I
Oh,
was
yeah.
wondering. So if you didn't increase your dose, it's a little less likely that it was related to the med, but it absolutely could still be related to the med, which is why the
Mm,
protocol has always been 4 weeks, 4 whole
mhm.
weeks at the dose before you increase.
Yeah,
And as you guys know, I don't want you to increase if you don't need to, but and
yeah.
then some doctors believe in every time they go up in a dose, if it depending on because they're more comfortable with increasing. But some conservative doctors will make a patient wait 4 weeks at every new dose because of the potential for reactions. So yeah,
I've
at
been
that,
on it for a minute. I've been on it for a minute. I haven't had any problems with the dosing or
how many
anything.
weeks? How many weeks have you been on the 2.5?
Oh, it's been about 7 weeks or something like
Okay.
that. I think it was just my period this time for some reason. It just was bad. And
Totally.
so that's the
Totally.
only reason I had to eat. But I don't think it was because
The
last month
medication.
yeah, I don't think it was because last month we had talked about when I was saying I ate a few tortillas so that I could take my medicine, take Advil. And then you were like, I think maybe you should try like the chia seeds and water.
Yep.
So I wasn't hungry at all. Like I did the fast the last time I was on my cycle. It just was for some reason. It just was really bad this time.
What we were talking about earlier, helping your body detoxify. So the GI liver support and then the DIM. I think those would be the two
Mhm.
supplements that I think would be a good addition to your protocol.
Okay. All right.
And right now the links are broken because we updated a new FullScripts account. So I should have those links updated by tomorrow on the welcome form. And it'll say liver GI detox, DIM for hormonal issues. So did you discuss how long we should stay on AOD? Should we cycle the peptide? So there's no set length that you necessarily need or should be on AOD. Remember AOD, and we are losing AOD soon. So we got to start talking about the big picture. Fat mobilization support is really what we should say. And the replacement for AOD, you have a couple options. MOTS, although that one got banned too. Second FDA, man. Samorelin, though, is steady. So Samorelin for sure is around. Although I am talking to many compounding pharmacists that are like, you know what? I don't care what the FDA is doing. I'm still going to provide peptides. It's just a really wild time right now. And every week I find something different. But what is stable is they banned what they banned. That's stable. But accessibility and availability is seems to be a week by week thing. So as you guys know, I'll always update you. But right now, yeah, we still have AOD. And so I like the idea of utilizing AOD alongside your tirzepatide 50% of your goal, right? Because that also leads and parallels the other question. Should I stay on tirzepatide? How long should I stay on that, right? The very Western allopathic answer is for the rest of your life. This is a disease. It's a chronic, irreversible disease. So you should stay on it for the rest of your life, right? And then there's multiple tiers down from that. The rest of your life, maybe a couple years after you hit your weight loss goal, a couple months after you hit your weight loss goal, up to your weight loss goal, and then prior to your weight loss goal. All of those different scenarios are possible scenarios that some of you will be able to do, right? And the only way to find out is if you want to find out, like on a lower, like stopping sooner, right? The only way you can find out is experimenting. But if you run the experiment, you have to accept what comes along with the experiment, which might be a rebound or some loss of results or a slowdown, especially if we're talking about tirzepatide. So stopping AOD is much less traumatic. You won't feel different, right? Because we talked about AOD. You don't necessarily feel different when you're on it. So you don't necessarily feel different when you're off of it. Results might slow down. Weaning and slowing down off tirzepatide, that's a beast, right? That's a bigger effect. Just like you feel when you start it, you feel when you come off of it. That's the game that you need to play. So if we ignored finances for a second, because that's the biggest variable all of us obviously have to consider. If we ignored finances for a second, I like the idea of taking both until you hit your weight loss goal, and then you start to play around with the wean off. So that's my sort of ideal recommendation that I think would work the best for the most amount of people. And if you did that, when you hit that goal, you are either going to be successful with weaning off and straight to stability, or you're going to wean off and have some stability and then maybe start to rebound a little bit. And we've talked about this, right? And then you just go back to it, right? Go back to the medication and maybe do a smaller round, maybe a lower dose, and make some more improvement. Because remember, it's the improvement to your physiology that gives us the stability to need less medication, right? And there's no way any of us, me or you, is going to know where your body's at until we experiment. So we do have to run some experiments at some point, but the earlier you run it, the more potential resistance and issues you're going to run into. But if you're in my coaching, we'll guide you and we'll coach you and we're correct. So in summary, AOD is definitely easier to wean off of and stop, but going back, and then tirzepatide is more challenging, but going back to how long you should stay on it, I think the quick answer after you heard all that is financially. It's a phenomenal peptide. It's very safe. Doesn't have any of the downside that tirzepatide has. So I'd stay on it as long as you possibly could. When like I'll use fat mobilizing peptides for the rest of my life, but I don't use them every day because I'm in the lifestyle, right? I just use them on my long fasts. If I don't have it around for my long fast, I don't freak out. I don't need it for my long fast, but I certainly want to maximize the results of my long fast. And so I'll be using fat mobilizing peptides during my long fast for the rest of my life. And God forbid I ever had a super stressful month in my life and I gained some body fat, then I might do another round of tirzepatide. And I've talked about that a little bit on my individual lives that I do out there for the marketing purposes. And so sharing this little tidbit with you guys, I am becoming more and more comfortable as I continue to see more and more literature behind the long-term aspect of these meds. I will never think it's okay to be on any medication for life without a reason. That's the key, without a reason. I don't ever think this med or any other med's ever going to be completely side effectless. That just doesn't make sense because medications are foreign to the body. So the goal should always be getting to the point where you can wean off. But I would say 6 months ago, a year ago, I was probably a little bit more extreme about we got to get off as quickly as we can. And now I'm like, safety profile, the amount of conditions that this medication is probably going to become a treatment for, like neurodegenerative diseases, autoimmune diseases, it's crazy. And with all these different studies, we're seeing higher amounts of safety. So I am a lot more comfortable now with utilizing this as a tool. But the supplements are there, the med is there, figuring out a balance, taking your time with it because life is dynamic and there's always going to be different levels of stress. Yeah, just wanted to give you guys that update. And obviously, I'll be making videos for you guys and content. And the overall picture of what we're trying to accomplish when we hit our goal, though, it hasn't changed.